Patients don't just crash out of nowhere. There's always signs first that, they would normally present with. But the question is, are you trained to notice them? And so we're going to talk a little bit about it. So if you're a new nurse, if you are an experienced nurse, I feel as though this is one of the most important skills that we need to build on so we can recognize early when we are having patients that are deteriorating so we can actually save their life. And if you haven't subscribed as yet, I would love for you to go ahead and subscribe to my YouTube page here at ThinkNursing. My name is Stacey. I talk a lot about nursing. And today we're going to talk about one of the most important skills that you need to have. Most early warning signs for our patient, they show up in our vital signs trend. We're not talking about one abnormal number. We're talking about the vital signs trend that we're writing down. It's either the rising heart rate, the blood pressure dropping, the increase in their respiratory rate, there is changes in their oxygen saturation, or the patient is having new confusion, or they're just restless. It's even as far as sometimes the patient saying to us, I don't feel right, nurse, or I'm just feeling like I want to die. That is something that matters as well. Sometimes you might be looking at the patient and the patient is just looking cyanotic, pale, clammy. They're having, their urine output dropping or decreasing, their pain increasing. But the problem is that some of us, we focus so much on task and not looking at the trends in our vital signs. And that is a problem why we're not identifying when our patients are deteriorating. But what we need to do is when we're going to see our patients, we need to start asking ourselves what is different each time we go in. And that will help with sharpening our awareness every single time. Strong nurses don't wait for emergencies to happen. What they do is they start catching them before it happens. And if we go inside our patient's room and every single time we're observing and assessing for any changes, then we'll be able to identify and preventing our patients from coding and crashing on our shift. And so it's very important for us to pay attention to those patterns and not just numbers in our vital signs, because it's very important, because those are the things that is alerting us of changes of our patients deteriorating from early. Yes, those subtle changes, it's alerting us of bigger problems that can happen later on if we don't address them from early. Go ahead and save this video, send it to a friend or two, and let some nursing students come over and hear other things that they need to be aware of so they can, so we can all build together and be stronger nurses out there so we can give better care. I do hope you will have a wonderful day. Remember to go ahead and subscribe. Until then, I'll see you in the next video. Bye.